Hello everyone. I'm Goral Gandhi. I'm a consultant clinical embryologist and I'm in this infertility and IVF since last 25 years. So when I say embryologist, basically what I mean is that I make babies in the laboratory. I fertilize the eggs of the female with her partner's sperms and create babies in the lab. This is what an embryologist does. And today we will be discussing various aspects about IVF. So we'll begin with what is infertility, what is IVF. We'll discuss some myths surrounding IVF and just a little bit of basic introduction about what IVF is all about. Infertility is when a couple cannot get pregnant despite having carefully timed, unprotected sex for over a year. Now, there can be many causes for infertility. These causes can be due to the women, which we call as female factor infertility, or due to problems in the men, which we call male factor infertility. Coming to female factor infertility, the woman may have some hormonal imbalances or she may have a condition known as polycystic ovarian syndrome or endometriosis. She can have problems with her ovarian reserve. So her number of eggs can be little less, the quality of eggs can be poor. So, there can be a variety of problems. As far as men are concerned, they can also have hormonal imbalance. For men, an important factor is their sperm parameters. So we need to check if the man has adequate number of sperms. If these sperms are good swimmers because they have to swim a large distance and go and reach the egg and fertilize the egg. The sperms have to be of a particular shape. So if any of these parameters are not all right, then the men can have difficulties in making the woman pregnant. So there are all these variety of reasons for your infertility, and it is extremely important to first diagnose the cause of the infertility because your entire treatment is going to depend on the cause of your infertility. When a couple comes to us, it is the first thing we need to do is, a battery of investigations to diagnose the problem correctly so that we can treat it effectively. So, if you and your partner are trying to conceive, then I can understand that each month that goes by without a positive report can be extremely traumatic and frustrating. All of us in today's age want instant gratification. When you are trying to get pregnant, please try and be little patient. Getting pregnant actually needs a perfect rhythm between the egg, the sperm, the uterus, and many other known and unknown factors. Do not rush to see a fertility doctor, but there are certain guidelines depending on your age and your overall reproductive health. If you are under the age of 35 and overall in good health, then wait for 1 year before coming to see us. It does take a year for a normal young fertile couple in their 20s or early 30s to get pregnant. If you are over the age of 35, then wait for 6 months. After 35, we term the women as advanced maternal age. So after 35, the chances of conception comes down and we would recommend that wait for just about 6 months, and if you are not getting pregnant, then come and see us. If you are over the age of 38, then I would say that come and see us right away. As soon as you decide that you want to have a baby, you should ideally go and consult a fertility specialist and just get yourself evaluated so you get an idea whether it is all going to be fine or you're going to need a little bit of assistance. So over the age of 38, I would say don't wait and come and seek at least an initial preliminary consultation which can just test your overall fertility wellness. If you have thyroid, then see us right away. Your thyroid controls all the hormones. So it is very important that when you are trying to get pregnant, your thyroid has to be under control. And if you have thyroid issues, then do not wait for 6 or 12 months. So it is everything, you have to look at your situation, your age, your overall health, other conditions, and that is decide when to see. IVF or in vitro fertilization. The literal meaning of IVF is outside the body. This means that the whole fertilization process is happening outside of your body. Your eggs are getting fertilized outside the body, your babies are being created outside the body. I can divide the IVF procedure in 4 steps. The first step would be the preparation prior to IVF. So when you come to see us, it is all going to begin with a series of investigations. So we are going to use before IVF, we want you to be in good overall health. So we are going to get all these parameters under control. We'll put you onto certain supplements before you go through the actual process of IVF. The second phase of IVF would be what we call as ovarian hyperstimulation. Now, every month, your ovary is making one egg. By nature, there are few eggs in your ovaries every month, but only one of them grows and only one of them has a chance to become a baby. But this one egg is not enough for us to do IVF. We want multiple eggs so that your chances of becoming pregnant increases. So we give you hormonal injections to make these multiple eggs in your ovaries. We start giving you hormonal injections and we start tracking the growth of your follicles or the growth of your eggs. This phase goes on for about 10 to 12 days. After 10 to 12 days of injections, when your eggs reach just the correct size, at that time we give you a trigger injection. And we are going to retrieve all these eggs from your ovaries. So the third phase becomes the egg retrieval process. After that, once the eggs are retrieved, the third phase is fertilization of the eggs and creation of your embryos. So this is where the embryologist comes into picture. The embryologist identifies all the eggs from the follicular fluid and fertilizes these eggs with the partner sperms using the most suitable method for that particular semen sample. At the end of this growth or embryo culture period, the embryologist is going to select the best possible embryo, and then this embryo is going to be transferred into the uterus of the woman in the hope that she should get pregnant. The success of IVF largely depends on a lot of factors like the woman's age, the egg quality, the sperm quality, the uterine health, lot of factors. If there is one single most consistent factor that affects the success of IVF, it is the age of the woman. So, if everything else is right, then if you are under the age of 35, then success rates of, success with the first one attempt of IVF remains at about 50% when you're under 35. After 35, between 35 to 37, this comes down to 40%. 37 to 38, this comes down to 30%. After 38 to 40, it is about 20%. After 40 years of age, success rates with one attempt of IVF is about 10 to 15%. But remember, 10 to 15% is also a good chance, because you remember what earlier I had told you, that a normal young couple takes 1 year to get pregnant. It is not that, if you have first time you're having unprotected sex at the right time, you're going to get pregnant. It doesn't happen that way. I would like to say that today science has advanced so much that we can confidently say that Nobody remains childless. Today, nobody remains childless. We have solutions for all the problems. It's just that for some couples, the journey is little longer. For some couples, the journey is easy. For some, it is slightly more difficult, slightly longer. But eventually, everybody reaches their goal. Everybody dreams of becoming parents are real.